Hey there. Welcome to Baby Basic USA, the place where new moms get all the essential tips and advice to make parenting easier. If you're a new mom or expecting a little one soon, today's video is all about breastfeeding. We know it can be overwhelming at first, so in this ultimate guide, we'll cover everything you need to know to get started, stay motivated, and make breastfeeding a smooth experience for you and your baby. Make sure you hit the subscribe button and turn on notifications so you never miss out on helpful content like this. Section 1. The basics of breastfeeding. First things first, let's talk about the basics. Breastfeeding is the most natural way to nourish your baby, but that doesn't mean it always comes naturally. Here are the essentials. What is breastfeeding? Breastfeeding involves feeding your baby with milk produced by your breasts. This milk provides all the nutrients your newborn needs in the first few months of life. How breastfeeding works. The milk comes from your mammary glands triggered by your baby's sucking. Early on, your body produces colostrum, which is rich in antibodies and nutrients, followed by mature milk. Breastfeeding positions. Different positions work for different moms and babies, but try the cradle hold, cross cradle, football hold, or side-lying position to find what feels most comfortable for both you and your baby. Section 2. Benefits of breastfeeding. Why choose breastfeeding? Here are the incredible benefits for both you and your baby. For baby, perfect nutrition in the right proportions. Boosts the immune system with colostrum and antibodies. Helps with bonding and emotional development. For mom, helps with postpartum recovery by releasing oxytocin. Lowers the risk of certain cancers. It's a natural way to lose pregnancy weight. Section 3. Tips for successful breastfeeding. Now that we know why breastfeeding is so important, let's get into some tips for making it a success. Get comfortable. Find a quiet and relaxing place to nurse. Sit in a chair with good back support, or use a breastfeeding pillow to help keep the baby at the right height. Latching. A proper latch is crucial. Make sure your baby's mouth covers more of the areola, not just the nipple, to prevent discomfort and ensure they get enough milk. Nurse on demand. Newborns tend to feed frequently, often every 1 to 3 hours. So let your baby nurse whenever they're hungry. This helps build your milk supply. Stay hydrated and nourished. Drinking plenty of water and eating nutritious foods will help keep up your milk supply and keep you energized. Section 4. Common challenges and how to overcome them. Breastfeeding doesn't always go smoothly, and that's okay. Here are some common issues and tips for overcoming them. Sore nipples. Make sure your baby is latched properly. If you experience soreness, try nipple cream or air drying your nipples between feeds. Low milk supply. Increase your milk supply by nursing frequently, pumping in between feeds, and staying hydrated. Engorgement. If your breasts become swollen and painful, try expressing milk to relieve pressure and use warm compresses to ease the discomfort. Section 5. When to introduce formula or pumping. While breastfeeding is highly recommended, there are times when you may need to introduce formula or start pumping. Let's talk about that. Formula feeding. If you're unable to breastfeed or supplementing with formula, talk to your pediatrician about which formula is best for your baby's needs. Pumping. If you need to return to work or want to store milk for later, consider using a breast pump. Make sure you pump regularly to maintain your milk supply. Section 6. Breastfeeding myths busted. There are so many myths about breastfeeding, so let's set the record straight. Myth. You can't breastfeed if you have small breasts. Fact. Breast size doesn't affect your ability to produce milk. Myth. Breastfeeding should never hurt. Fact. Some discomfort in the early days is normal, but pain could indicate an improper latch. Section 7. When to seek help. If you're struggling, it's important to ask for help. Here's when to reach out. Painful latching. If your nipples are cracked or bleeding, consult a lactation consultant to ensure the baby's latch is correct. Milk supply concerns. If you're worried about your supply or baby's growth, don't hesitate to talk to your doctor or a lactation consultant. So there you have it, the ultimate guide to breastfeeding for new moms in the USA. Remember, breastfeeding is a journey, and every mom's experience is different. Be patient with yourself, trust your instincts, and don't hesitate to ask for help when you need it. If you found this video helpful, don't forget to like, subscribe, and hit the notification bell for more tips and advice on parenting. You've got this, mama.